The name of my first Changemaker project is developing readily accessible technologies for cervical cancer screening in global women's health. In a lot of developed countries, cervical cancer is almost non existent, and more than 90% of deaths related to cancer in developing countries. So, the first thing that I was working with the lab to solve was the expensive diagnostic tools which were not readily available in resource limited settings. I have two devices here, the coloscope and pocket colposcope. And these really small portable devices are meant to replace a standard colposcope, which, can be pretty bulky, analog. The provider looks through to see a magnified view of the cervix, but it's not very portable, typically requires constant supply of electricity, which might not always be available, and can be quite expensive. So we've made these portable versions. My second Changemaker project is developing a telehealth plus patient-centered electronic medical record system for primarily targeting sub-Saharan Africa. And the problem it was designed to address was access to specialist providers, specifically in chronic disease management, but also ready access to health records and data for personalized AI-based recommendations. There isn't a lot of data to understand trends of some of these chronic diseases in sub-Saharan Africa. So the best way to get patient data is through their electronic health records. And most of those health records in a lot of smaller clinics are kept on paper, and it's really hard to access them. It's also really difficult for patients to keep track of their own medical records and see what's going on and understand what's going on. The telehealth aspect was to address that issue, to allow anyone to be able to reach a specialist for their condition at any time. And the health record aspect actually allows patients to store their health records right on their phone in the app. When they see doctors through application, the doctors send visit notes directly to the phones. It helps them to provide the identified data that can be used to understand the context of chronic diseases like diabetes in the region. In the next 5 to 10 years, I would really love for at least one or two of the projects that I've been working on to be making a scalable impact in bridging health disparities and really making a change in people's lives that can be felt.